Minister of Health and Social Care, Federal Government of Somalia, Fawziya Abikar Nur. Please.
Thank you so much, Excellency, Prime Minister, Deputy Prime Minister, my colleagues, Somali authorities, ambassadors, our international partners, the commissioners, all the delegates. Assalamu alaikum, and a very good afternoon to you all. I would like, in principle, to commend the job of the organizers, and especially the health workforce who is there to make us observe the COVID protocol. Thank you all. I will be speaking briefly, presenting these remarks on behalf of the Social Sector Subcommittee. COVID-19 pandemic is a reality of global health crisis and has been recognized as the greatest challenge the world has faced in decades. The total COVID-19 positive cases recorded in the country is 4,525, with 121 associated death cases, and over 900 active cases remain in the country, posing the risk of further transmission of the virus to the community. Positive cases have been declining since May 2020, but the number of positive cases recorded are on the rise these days, signaling potential second wave of COVID-19 pandemic. As per the global recommendations, the federal member states and the federal government of Somalia stood up to not only detect the virus, isolate and manage cases, but also all the preventive measures have been put in place in a coordinated manner led by the Prime Minister. We are grateful to the generosity and the technical assistance by our international partners to support the COVID-19 preparedness and responses across the country. Nonetheless, several studies were conducted in the country to measure the impact of COVID-19 on social development of the country due to the pandemic and policy actions taken. Prior to the COVID-19 pandemic, the Joint External Evaluation for the International Health Regulations, IHR, in 2016 acknowledged that Somalia had nascent capacity in most of the 19 technical areas for the implementation of the international health regulations, coupled with multiple challenges health system of the country was facing. Despite Somalia has made significant progress on reducing maternal mortality and under 5 mortality over the past 2 decades, COVID-19 pandemic has, however, now overshadowed and potentially reversing the health gains the country has made as the demand of healthcare services has been observed declining by at least 11% of the outpatient visits due to the fear of being infected by the virus. Estimates are telling us that the immunization coverage can drop by 20%. That means 313,500 children without pentavalent 3. And facility-based deliveries can decrease by 4%, God forbid. While there was no testing facility for the COVID-19 before the pandemic, the country has now 11 testing facilities, all built over the past 6 months, a sign of government's responsiveness and accountability to manage this pandemic despite severe resource constraints. So far, 60,393 samples of COVID-19 were tested in the country, which means that every 5 persons out of 1,000 have been tested for COVID-19 in the country. Because of resource constraints, our testing capacity is still limited. With the support of our partners, the government was also able to quickly establish isolation centers across all states. Currently, 16 of these specialized health facilities for treatment of COVID-19 patients are functional. However, no one is safe until everyone is safe. Owing to porous borders and cross-border movement of people, the government remains vigilant. Any sign of resurgence of virus is being monitored closely, and appropriate public health measures would be scaled up whenever there are signs of resurgence or recirculation of virus. There is an intense planning process led by the Ministry of Health in collaboration with our health partners to prepare the health sector to receive COVID-19 vaccine when it becomes available, sometimes toward the third or the fourth quarter of 2021. This is being made possible by the COVID-19 Vaccine Global Access Facility, known as COVAX facility. As for the impact on health, in education, COVID has adversely impacted our education system, disrupting school calendars, causing gaps. School closures put decades of education gains for Somali children at risk. Studies show that 45% of families with school-going children reported that since school closure, children have no access to learning materials, with increased risk of teachers losing their jobs coupled with lowered household income, which will further increase the risk of financial crisis in the education system. Our government, in close cooperation with international partners, has been trying to come up with alternative options of continuing the education of children, such as remote learning for private schools. In mid-March 2020, the federal government of Somalia has announced stay-at-home and social distancing orders nationwide to curb the spread of SARS-CoV-2 virus. Hundreds of thousands of casual laborers and small business suffered. Airline travel sector alone furloughed numerous workers. Unemployment increased, worsening poverty rates. A study shows that 45% of the population report their concern of losing jobs or unable to earn income in the near future, where the 66% of those surveyed across the country reported underemployment or unemployment. Besides, the 2020 good season harvest is expected to be between 20 to 30 lower compared with the long-term average due to the combined impacts of desert, locust, and other pest infestations, flooding and extended dry spells, and the COVID-19 pandemic. As a result, the number of people in severe food security has been estimated to triple by the end of this year. An estimated 2.6 million internally displaced persons live in an overcrowded and poorly served campus. These vulnerable communities are the hardest hit. The government's social protection initiative, known as Pahnano, is a good step toward, though not enough. In conclusion, while the government has prepared to respond to potential second wave of COVID-19 pandemic, the federal government is very conscious to mitigate the impact of COVID on social development. The government is therefore aiming to enhance government's commitment in increasing domestic financing and coordination to social development, with primary goal of maintaining the provision of basic social services during and post-COVID pandemic, mobilize more external resources from our international partners, thank you, with more engagement and leverage the resources from private sector and diaspora to address gaps in protection needs, preventing and responding to COVID-19 pandemic, with more attention to long-term solutions of building back better. Support and strengthen the peace humanitarian development nexus to ensure joint planning and monitoring towards resilience building, institutional and alignment of resources and projects to the National Development Plan priorities. I thank you for your attention.
Thank you, Minister Fawziya Abikar Nur. Now I would like to welcome Abdulrahman.